Yeah, thanks a lot, everyone, for joining this Instagram live event today. We are celebrating Women's Day at ClearCals, and with us we have one of our favorite members of the ClearCals team. So, Asfia has been with us for close to 4 years now. She has been instrumental in developing the Hint nutrition app as well as the expert app. Does quite a lot of work around the team, and so thanks a lot, Asfia, for joining us, being with us
Thank you.
here today. So, the primary objective of today's event is to know more about Asfia and help young dietitians get inspired through her and understand how to make a career in the field of nutrition, and also learn more about the intricacies of what she has done at ClearCals and how talk about the various things she has made a decision on at ClearCals, and understand the nuances of personalized nutrition, especially her experience with clients at ClearCals and also her early career. So, Asfi, I think without further delay, we will start our conversation.
Sure.
So, to begin with, can you share a bit about your journey, where you have started, how long it has been?
Yeah, so my journey started in the year 2008. So it's when I always aspired to become a doctor, but due to some age criteria and age issues, because I was falling short of 6 months during my MSET, and that time I realized I couldn't go further with my BBS degree and all that. So that's where my nutrition journey has begun. And it was my lecturer who advised me to go ahead with this field. So I joined St. Anne's College and graduated from there in applied nutrition and public health. So during this phase, I enjoyed thoroughly, dealing with all the basic biochemical things, biochemistry, and going to slum areas, educating people regarding public health and nutrition. And from there, I joined Poti Women's College and completed my master's in nutrition and dietetics. So I completed it in the year 2013. From there on, I started working as a dietitian with TrueWeight Wellness, and now I'm working with ClearCals Private Limited. So in the meanwhile, I started with my internship with Global Hospital, and also I secured few certifications like diploma in child nutrition, diploma in sports and exercise nutrition. Apart from that, I'm a certified diabetes educator.
Great, great. So, how was your experience when you were starting your career, with TrueWeight? What was going on at that point of time, back in 2013?
So honestly speaking, I was very perplexed. Like, should I go ahead with this field? I was not much aware regarding various clinical conditions and all that. So it was a very good experience, like with the mentors and all that. And I being a fresher, so how to deal with the clients and all that was very challenging with that time. But the team was very coordinating, and all of them were female members basically that time. So that way it was very effective and helpful for me, planning with the
Anyone,
diets and all.
anyone who particularly mentored you or guided you in this direction?
Uh, not much, but I developed my passion for nutrition during my undergraduate days. So there was a lecturer who used to tell me uh, nutrition is the only field which would be helpful for you from your birth till your death. So that thing that got engraved in me. So I took it very seriously, and I realized, yeah, that's something which is very important in every phase of life, be it childhood, be it puberty, be it middle age, be it old age.
Great. So, after your time with TrueWeight, where were you? What was your next step in your career?
So after TrueWeight, I conceived, I had my son in 2017, and during that phase, I was working with as a consultant with various hospitals like Shravani Medical Sciences, and there was Avis Hospital where I was working as a dietitian with them. So I used to deal with lot of gynecological cases, and apart from that, I used to deal with lot of females suffering from hormonal imbalances like PCOD, thyroid, menopause, basically anemia. So that
So,
was my journey.
by the time you joined ClearCals, you were already an expert in managing chronic conditions, right?
Yes, yes.
So, so where did you learn the art of doing this? Like, where exactly you got first introduced to a chronic disease client?
So the whole credit, I feel like it will go to my clients itself during my journey at TrueWeight, because I worked with them for 3.5 years. So during that time, I used to deal with lot of cases. So that time I developed. So my clients, after seeing their results and all that, like I became expert in this field.
Great, great. So, so after I think close to 6, 7 years in this field, you have joined ClearCals, right? So in
Yes,
late
yes,
2020, something you have joined us.
yes,
So and you have contributed to, so in the 2021 and 22, we were working on the database and also the Hint app development. Later on, we were working exclusively on this Hint Expert app for dietitians. So in
exactly,
both these cases, you spend quite a lot of time. Like say, I mean, we spend months together in creating all this scientific data, nutrition data for all this cooked food. That itself took us like close to 18 months till the time we launched the application. And
right,
also on later, we had so many uh, various types of personalized diet plans which we have created,
exactly.
which we currently use as the instant diet plans on the Hint. So, how was the entire experience, and what do you think of this concept of data-driven personalized nutrition? And what do you think makes Hint stand out of the crowd of the nutrition apps currently in the market?
So it was very challenging for me, to be very honest, and working with a team of engineers. Uh, it's like translating complex information into simple ones. So definitely this data driven, what we have like IFCT data and USD data and what we have working on the in tab over the past 1.5 years, definitely it was worth working on it. Because we can deal with lot of complex cases or multiple conditions at a time with the help of these guidelines what we have developed over the period of time.
Great, great. So, and do you think this is the way to go in the future? Go ahead in the future. Like, say, for any particular personalized diet plan you create, you figure out what ingredient or recipes are you going to recommend and map them in certain way that, like, for your daily nutrition requirements are met according to the NIN requirements if you're dealing with an Indian client or a local regulatory authority requirements if you're dealing with a client in a different country. Do you think this is the direction to go that will simplify things
Uh,
going forward?
Yes, yes, definitely. I think so because 10 years back, like when I was dealing with the client, like when I have started my career, I started with pen and paper, giving diet plans, and it was very difficult at that time, like to calculate everything. So in our college days, also we literally used to sit with a calculator and with a nutritive value book and calculate each and every nutrient. Now, after 10 years, things have been become very easy. So I think more and more apps like Hint and all that should come into the market to make dietitians' lives very easy. So now I can proudly create a diet plan with 31 nutrients, like what we offer basically to our clients. And that too with lot of ease, like we give lot of recipes and all that. Earlier it was very challenging to share recipes also with the clients and to track their intricate or minute details. It was very challenging.
So, when you're designing personalized diet plans without data or a database, what are the typical? What's the typical process like? Like, what are the steps you involved in that?
Pardon me, Dr. Krishnan?
So, I was saying, before you were like say before you joined ClearCals, you were designing personalized diet plans. Right? We are not the ones who
Right,
invented it. So, how was it done
correct.
earlier, like before ClearCals?
Uh, so it was done based on the RDA tables again. So, so we used to focus only on the macronutrient and sometimes only few micronutrients. Like if it is a female personnel, then we used to focus only on the calcium or the iron part of it, not all the nutrients in detail. So it was like quite difficult, like every time referring to the tables or every time referring to the books for getting a few details or the minute details. Now things have become much easier. Everything is handy, like everything is being implemented in the software. So it's very easy to. create a diet plan.
Okay. In fact, there is a layman question from my side. Started Clear Cals, right? Like our experience with nutrition was minimal. We always used to hear all these commercials talking about calories and protein and stuff. But personalized nutrition or medical nutrition therapy is something like very specialized and only probably dietitians know about.
Right.
So,
Right.
what's the benefit of a personalized nutrition plan for a client? Like, why should someone follow it? Will it really affect the health outcomes of an individual? Can it improve health? Can you reverse conditions with personalized nutrition?
Yes, yes, definitely. I think like personalized diet plan, it will definitely help in making your lifestyle better actually. So with the personalized diet plan, we focus on all the aspects, be it lifestyle management, be it personal likes and dislikes, be it food allergies and all that. And whatever diseases the client is suffering or the patient is suffering, we get to know all the details regarding that. And based on the assessment, we create a diet plan which will be easy for the individual to follow. And with the help of medical nutrition therapy, with whatever medicines and all that, we design the diet plan which will be very effective. And the outcome would be really helpful when the diet plan is personalized.
So, what goes into this diet plan? Like, say, you have like at our organization, you have already created like hundreds of them, right? And you might
Right,
face numerous challenges when you're doing it. Like, it's not only one
correct,
condition. We cater to around 13 categories,
right,
and
right.
and everything like each category is different from the other. What are
Correct.
the challenges you have faced in this entire experience when you're creating these diet plans?
So creating a user persona while planning a diet and having a particular persona, like if an individual is suffering from PCOD, so planning the diet according to their follicular phase and luteal phase, like what phases the females are growing through, and incorporating seed cycling in the diet plan, having appropriate amounts of carbohydrates, protein, and fat, and simultaneously meeting other micronutrients. So these are the challenges that I have faced by planning the diet. Same goes with diabetes management also. Like we have to look into the foods which were low in glycemic index and low glycemic load, and at the same time which would be helpful in avoiding hypoglycemic episodes or hyperglycemic episodes.
Okay. So, like, and it varies from say chronic disease to the other one disease to the other, right? Like, so
Right, right,
whatever applies to PCOS may not apply to diabetes, and same thing with hypothyroidism or say dyslipidemia or hypertension. So for
correct,
each case you need to come up with some specialized foods which help them stop the disease progression,
right.
right? Yeah, so you are a certified diabetes educator, right? So, and now looking at the growing incidence of diabetes and pre-diabetes. So, what exactly did you do when you're designing these diet plans at ClearCats? Like, what was your approach?
Uh, So, while planning the diet, I followed a holistic approach for diabetic and pre-diabetic individuals. So, it's not only about carbohydrate management, it's like lifestyle management for diabetes. And we have to look into all other aspects like balancing all the macros as well as micronutrients, balancing their sugar intake basically, giving proper foods at proper time, as I've mentioned, like giving foods which are low in glycemic index and glycemic load, and of course including functional foods which acts as medicine for these individuals.
Okay. So, see, there is a lot of competition in this space, right? Like, with respect to diabetes treatment. And there are companies which claim that they can reverse diabetes, right? So, what's your take on it? Like, what exactly is the reality? Like, what do you think so what is the belief of the dietitian community? What do you guys think about diabetes reversal?
So, as a dietitian, I feel like with proper diet, lifestyle management, with proper medication, and if you follow proper medical nutrition therapy, with the advice of your diabetologist and also your dietitian, you can remit diabetes to certain extent. You can go into a remission stage, but not into reversal stage. If you're following a lifestyle, proper lifestyle and advice, so you can remit it for a particular period of time. And once you stop and go to the previous changes, like before following the diet plan, then definitely you're going to have diabetes or pre-diabetes. So that's my
So,
belief.
what is the like say in simple terms, what's the difference between diabetes remission and diabetes reversal?
So reversal is like you are going into non-diabetic stage. You are completely off medication and you are following your lifestyle, a healthy lifestyle. You're not taking any medicine. In remission stage, you are put off medicines for a certain period of time and you're following a healthy lifestyle with dietary modifications, you can go into a remission stage. And that is for a particular period of time.
And are there any case studies or any, like say, population-based studies for diabetes reversal? Is it really something which happens in people?
So there are many companies, as you have mentioned, that reversal is happening and all that, but I have seen their reviews and all that. I have seen their feedback. After certain period of time, their diabetes levels or HbA1c levels are back to 5, above 6.4 or 7. It's like that.
Okay. So basically, what they are experiencing is remission rather than reversal.
Exactly.
So how about pre-diabetes? So when your HbA1c is slightly lower than the diabetic level, how
Right.
does that work? Is it reversible?
Pre-diabetes, yes, definitely it is reversible because you are not put onto any medication by the diabetologist. With simple lifestyle changes, with incorporation of certain foods in the life and proper following a proper lifestyle, definitely you can go back to a non-diabetic stage.
And you can maintain that without any issues whatsoever. You don't need to follow
Right.
very stringent diet after you have reversed your pre-diabetes.
Only a few changes like lifestyle modifications, as I have mentioned, you need to do that to maintain that state.
Okay. So yeah, today's Women's Day. Let's talk about women's health. So there
Yeah.
are again growing concerns about chronic conditions, hormonal balance issues in women. Yes, I mean, from early age onwards, like even from teenage, they are seeing high incidence of anemia, PCOD. So, what's your take on it? Do you have any dietary recommendations for men across various life stages?
Yeah, so in such cases, like I feel awareness is very important. Like many a times, like there are a lot of myths and taboos associated with diet plan, or especially with females who are into their reproductive age, or girls who have started their menarche, or they have started their puberty. So this time is very crucial to discuss with your family members, be it with your mom, with your aunt, and all that. Having a proper nutrition will be very effective in preventing the complications caused by this condition, basically anemia or PCOD. So for PCOD, so females have to follow a well-balanced diet, which would be a balance of carbohydrates, complex carbohydrates basically, and proteins, fats, vitamins, and minerals. And of course, exercise is very important in these cases to reduce the incidence of insulin resistance in the body and to normalize. So to align the hormones also in the body, they have to be very active. They need to track this. For anemia, focus should be on iron-rich foods and foods which are rich in B12. Apart from that, they have to focus on vitamin C intake because that would be really helpful in absorption of iron in the body. Without vitamin C, absorption will not happen. So that is very important. And for females suffering from thyroid, basically thyroid, hypothyroidism and all that, again, over a period of time, I have seen like at least with a 5 to 10% of weight loss, uh, thyroid hormone functioning will be proper in such females. So they need to focus on the weight loss, and apart from that, they need to focus on improving the metabolism by staying active whole through the day, focusing on foods which are rich in iron and selenium.
Okay. So, especially in the case of hypothyroidism, can people get off medication? They can stop taking Tylenol or any drug related to hypothyroidism eventually.
So in the past 10 years, so it was very difficult, like according to my research also, like what research studies I have done and all that, remission is possible to some extent, but it's very challenging actually. It again depends upon the doctor to take a call whether to put them off the medication or to keep the individual on medication. But this interesting case has happened in ClearCal's itself. So this happened with one of our female clients. So she was suffering from hypothyroidism, but remission was possible in her case. Her
Okay.
anti-TPO bodies were normal, and her doctor decided to put her on a trial period for 2 months. And when she was following her diet with proper guidance and all that, again she was put in a remission period for of 2 months.
So, her
So,
doctor recommended not to take any medication for hypothyroidism after
yes,
the.
yes, yes.
So again, coming back to the like the influence of nutrition on medicine, right? Like, see, there are people who believe that nutrition is the cure for all. Like, you can stop taking medication or reduce the dosage of medication which you're taking. So, how does this work? Like, what's the balance, or what's your view on this? How does nutrition influence someone's medication dosage or frequency?
So nutrition definitely influences the dosage of medication. I have personally seen it in my family members, with my clients and all that. But it should not be regarded as a substitute for medicine. So, for instance, when somebody is diagnosed with hypertension or with diabetes, so they believe that they can reverse it with diet, and they need not take any medicine, even upon doctor's advice. So, it's very risky for such individuals. Of course, there are certain conditions where we can avoid medicines, like in case of gastritis. You by proper following proper protocols and having timely meals at right intervals, you can avoid antacids during this phase. Same goes with PCOD also. Like you can avoid hormonal tablets if you're following proper seed cycling procedure and whatever protocols are there to be followed for PCOD. But definitely not in the case of very chronic illnesses like diabetes and hypertension. So that is completely doctor's call, like whether to reduce the dosage if the blood sugar levels are normal or the blood pressure is normal or if the thyroid levels are normal. Definitely it's doctor's call.
Okay. So to summarize, basically, anyone with high blood pressure or diabetes, and if they are suffering it through it for for a while, you should always consult your doctor before you stop your medication.
Right, right.
And and if there is a medication recommended by a doctor, irrespective of what kind of diet you're following, you need to keep taking it.
Correct.
So let's move ahead. Like, you have been working with us with a team of engineers, mostly technology oriented. So, what do you think was the influence of technology in nutrition? So, like, see, we are not the only ones in the space, uh, and there were many before us, and I'm sure there will be many after us as well. So,
Right.
how do you think technology has influenced the space of nutrition? Like, what are the significant changes you have seen just because of adding technology to this?
Uh, so as I've mentioned earlier, so I started my career with pen, giving diet plans on pen and paper, and I used to feel very bad scribbling and all that. So with the help of technology, like you can, so earlier it also used to happen like that clients have to wait for the dietitian's appointment for at least a week, or they have to take a prior appointment and all that. And they have to wait for hours meeting a dietitian and all that. With the advent of technology and with the technological advances in this field, so definitely there is a paradigm shift in this. So things have become much easier. Rather than complicating things, this has become much easier. Translating nutritional information has become much easier. With the help of technology, we can view clients from anywhere in the from the world. Like we can talk to them at any point of time. So we have clients globally in ClearCast. So we can talk to them at any point of time, give insights with the help of technology, go thoroughly with the diet plans, and everything is in one place with the help of technology. We need not search it or create different folders for their files or for their medical records, basically.
So now with the advent of AI and also all these new uh, gadgets which people are getting into market, right? Like,
Right,
so you have recently seen the rings which monitor your heart rate, sleep, and all that. You also
right.
have the sleeping patches which people put on their arm to track their blood glucose. So what excites you? Like, what recent breakthrough you find really exciting in this space?
So CGM is definitely one thing which excites me a lot, and if that is something which is integrated with our app in the future or blood pressure monitor, then definitely this is going to be a very hit in the market. And of course, with the help of AI, we are delivering timely notifications to the individuals, providing them insights with the help of AI. And there is also nutrigenomics, which is on boom, gut microbiome and all that. So these are few things, our advances in the nutrition. that definitely will excite me or exciting me to go further or research more regarding this.
So, any particular success story which you have experienced with ClearCals or before? Anything which you're really proud of in your career?
Uh, Actually, there are many, to be honest. So they are females who conceive within 1 to 2 months of following the diet plan, or their periods have got normalized. Their thyroid dosage has reduced. But definitely, as I've discussed, one success story is that of a female of clear calcs, as I've mentioned. So she got into remission stage. So that was a big achievement for me.
Okay. So, the person you mentioned about hypothyroidism, right?
Yes, yes,
So, she
exactly.
completely go off medication.
Yes,
So let's talk about our team. All right. So we are a small team, but we are a pretty diverse team. So we have engineers, all kinds of engineers. So most of them work on the tech part of it. Like I work on the science part, and there are team of dietitians who have contributed to the database for the creation of diet plans, create a lot of content as well. In the past 3 4 years, there have been many people working in the team. So how was the experience? Like, how did you find the collaboration and this multidisciplinary thing? Do you think it worked? Did it add anything to our application in any form?
uh, yes, definitely. It added more value, at least to my expertise or my career, basically. So I think every dietitian should get collaborate with an engineer. So all thanks to Sushil and team. So I have learned a lot of technical insights. Working with them, working with the team of engineers, with lot of brainstorming sessions happening simultaneously, A/B testing of the app, working on the recipe creator tool with the Hint Expert app and all that. So definitely it added a lot of value to me and also to rest of the team of dietitians.
Yeah, see, I, I can't speak from the tech team, but like from my side, I learned quite a lot from you. Like when I've started, like I've gone through the NIN documentation, the RDAs, and all those things, and
Right.
also I did my research in this area. But working with you, it's pretty straightforward. Like I could control my triglycerides. In fact, lose some weight. That's still a work in progress, but now I can clearly say, like working with dietitians, uh, from where we started compared to where we are right now, we got a very clear understanding of how to approach nutrition, not only to
Right.
ourselves but like anyone in our family. Now we are in a position to actually tell them like, see, this is what it is, and if you have further questions, go and talk to a qualified dietitian. Because
Correct.
earlier, uh, the approach, like anyone who is not familiar with the dietitian community, I used to do a basic Google search, see what exactly is solution for a nutrition solution for something which I'm suffering with or which someone I know is suffering with. And later on, we did not know exactly whether what we are reading or what we read is right or wrong. That was the primary challenge. Right? Like say, there are always, and if you look at the first page of the Google results, always there is conflicting information. Someone says egg is good for you, someone says egg is bad for you. So
Correct.
again, this applies to any topic in nutrition. But once we started working with dietitians, right, like once we got into the depth of this field, we personally have experienced like what exactly goes into creating a diet plan, and if you're providing someone nutrition care on a regular basis, what are the steps in the follow-up process, how do you do the assessment and all that. And that's kind of very insightful, like and this is something which we are trying to bring to public as well through the Hint Expert app and the Hint app. I hope it will reach as many people as possible and they'll benefit from it. Again,
Yes.
any recent innovations in the field of nutrition which you really like and which you think is going to make a huge change in the way you are approaching nutrition care?
With the invention of AI, so definitely, and with lot of research going on with the gut microbiome, so that is one innovation which is happening a lot. So I think like with the help of AI, when with the help, so early diagnosis of diseases is possible. So that is one change which is really going to help dietitians a lot in the future.
Okay. So what is the current stage? Like people are able to afford a gut microbiome test? Is it affordable or it's damn expensive?
It's very expensive actually. It's not affordable. So being a dietitian, like we have to make sure that few foods are there, like prebiotics and probiotics, which are being introduced on a daily basis in the diet, so that the individuals will have a healthy gut bacteria and they avoid certain diseases, lifestyle diseases.
Okay. Uh, so, I mean, you have worn various hats at Clear Cats. You create content, you talk to clients, you help us with marketing and all those things. Personally, also, you are doing a balancing act with kids and family and your career, right? So, how do you manage? What goes how is your day like?
So with two kids, definitely it's very hectic at times. But with my family support and my husband support, so things are at ease. Like I set boundaries for everything, be it professional. Balancing is very important. Balancing professional life and personal life, it's very important. So I make sure I take out time for writing blogs or articles or contributing to my career. And apart from that, taking out time for exercise or getting involved with the kids, being physically active with them, planning nutritious meal and all that. Whenever I feel stressed out, like I start doing some breathing exercises so that I'm relieved with that. So that way I balance everything.
Great, Asfia. In fact, see, you're not only an inspiration for young dietitians, you're an inspiration for some of us as well.
Right.
Because if we are doing whatever you are doing in a day, right, I think we'll go crazy very soon. So let's talk ahead. Like so, any dietary misconception or misinformation which really made you go crazy? Anything which you really don't like about and want to talk about?
So during pregnancy, right? So both of my pregnancies, like I faced lot of uh, you see elderly females and all that. So everybody will come to you and start giving advice and all that. Don't drink tea. Don't have blackberries. Your baby will be black and all that. The complexion will be dark and all that. So these are something that I think should remove from the mindset of the people. So one particular thing over a period of time, what I have observed in my 10 years of career is like people think that if you follow a diet deprived of nutrition, they will lose weight. So that is something. So they think that following a diet is like a magic band and you can lose like 10 kgs of weight in a period of 1 month or 2 months, which is not going to happen, which is not possible. So this is a very big myth that people should come out, and they should have a realistic goal, which is achievable over a period of time.
So, I mean, you're talking about balance and realistic goals and all, right? So, do you think hint will
Yes.
make any difference in their lives if
Yes.
someone tries it out?
Yeah, yeah, definitely. So, in Hint, like what differently we do is like we focus on medical nutrition therapy. And apart from that, the good part I like about Hint, like during the assessment, we go with the ABC method, like anthropometric, biochemical, and clinical. And apart from that, we go with the nutrition assessment and readiness assessment. So it's like a holistic approach what we are following at Hint. And we are setting up proper biomarkers. Like every 3 months, we advise our patients or clients to go for a particular test and all that. So we set up a particular goal. Like even if you are trying to lose weight, we are not going to give you any guarantee or something like that. It's 2 to 3 kgs of expected weight loss, and that is according to WHO norms also. What we are following. So everything is scientific based. What we follow at HIT, and I'm very happy that everything is evidence based according to our SOPs.
So, it's like we are not doing any magic. It's more on logic and science rather than anything like fancy or any gimmick here and there, right?
Yes, yes, definitely.
And so, just by I mean, using the Hint app, do you think people will benefit from it? They'll be able to change their lifestyle without any dietary
Yes,
considerations.
yes, definitely. So it's like we are making them accountable for their health condition. Even with under the dietitian's guidance, right? We have instant plans or predefined plans available on the app. They can follow it because that is being planned with a lot of thought process. While planning the diets, we have put in a lot of effort and a lot of scientific research was done while planning the diet. And apart from that, there are very good features which are there in our app, like logging the food, tracking your water intake, tracking a physical activity level and checking your diet summary, which is like sort of accountability for them. Like if they are deficient in a particular nutrient, so they can go to the recipe section and check for that particular nutrient recipes, and they can follow it, and they are able to meet the RDA. So definitely, it's going to bring a lot of change in the lives of individuals from day to day life.
Can you elaborate more on the instant plans? So we put a lot of effort from our end, but exactly what are instant plans? Why should someone try it out and try to manage their lifestyle?
So instant plans, like we design it for individuals who are busy in their lifestyle, who doesn't have time to meet the dietitian or doesn't have time to talk to a dietitian, who can follow the diet plans on their own. So keeping that personas in mind, so we have designed this instant plan, and people should definitely follow it because it's like a habit formation for them. And everything is broken into smaller habits in the instant plan, and if they follow it, like if we see scientifically, it takes 21 days to develop a habit. So if they follow small habits like having salads before a meal, having two meals at every 2 to 3 hours interval, having proper functional foods in case of diabetes or pre-diabetes, eventually they will able to see a change, not a drastic one, but definitely there would be a change. And at
Okay.
the end of the day, they would be accountable for their results.
Okay. And you also have a lot of recommendations, right, along with the instant plans. How do they
Yes.
help?
Yes.
All the do's and don'ts, FAQs and stuff.
So they are like a tip sort of thing. So if they follow it, they will come to know, like without any dietitian supervision or recommendation, because these are the recommendations made by dietitians, like what tips they have to follow and what do's they have to do and what particular foods they have to be avoided in certain scenarios and all that. If they follow it, then it's like mastering in that particular thing.
So, if someone wants to learn more about these instant diet plans, right, is there a place they can go and read about it or watch something and understand exactly what goes on?
Yes, yes. So we have a blog section on the app itself, or they can visit our website. They can read more about various disease condition, and diet plans pertaining to these conditions are also available on the instant. I mean the app, the Hint app, or the ClearCal's website.
So, if anyone wants to learn about instant plans, all they have to do is visit the website and check out the blog section,
Yes,
and they'll be able to
yes,
find everything related to this. And also, they can reach out to us and understand exactly what it is.
exactly.
So, I think we are close to 45 minutes in our conversation. So, let's uh, try to wrap it up and also, if possible, take some audience questions. Uh,
Sure.
any particular advice for aspiring dietitians or young dietitians who have just started their career?
So, one particular advice I would like to give is like invest in your education as much as possible. Nutrition is like a sea; it's a wide sea. So keep yourself updated with recent trends. Uh, research. Keep updated with latest research. Read research articles or blogs. Not even on our website, whichever there are good websites also. You can do that. Keep up to date. Be empathetic with the client. If at all, if you're an effective listener, then you will be able to solve the problems of the clients, the patients. So be empathetic with them. So that's one advice I would like.
Any favorite healthy recipe for our audience?
Uh, so, so I'm fond of soups. So this particular recipe, I usually advise in my diet plans also to all my clients, which is easy to follow, and it's like one pot meal sort of thing, which is very filling and balanced with all the nutrition. So it's moong dal vegetable soup, which is very relishing, which is also available on our Hint app. So
Okay. So,
it's a combination.
how does this help? Like, it will help you eat less or lose weight,
Yeah,
something like that?
yeah. It provides satiety, and at the same time, it helps in weight loss. So it's a combination of carbohydrates, protein, fats, vitamins, and minerals because we are adding a lot of veggies. There's moong dal in it. We are adding a dash of ghee to it. So it's easy to prepare. So if anybody wants to know regarding this recipe, they can check out in the recipe section of the Hint app.
Okay. So again, usually this is what happens on social media. So if you put this recommendation out there, people think every soup is healthy. So what type of soups should people avoid?
So any soup which has preservatives, that has to be avoided. Definitely. The ready to make soups which are available in the market, definitely they are not good and they are not healthy. And they will not help you with any sort of nutrition. So any soup that has to be made, it has to be homemade. Be it chicken corn soup, or be it a moong dal vegetable soup or a masoor dal vegetable soup. So it should be a balance of all the nutrients. The protein component should be there in it.
So any soup which is not ready to make and out of a packet is safe. And that would made it home. Uh, so let's gather your closing thoughts. So any particular message, especially with respect to the importance of women's health. So what do you think? Like how important is this? What's your message to the audience and also all of us?
So female health is very important. So all the females, like they have to focus on their health. That should be the priority. So they have to take utmost care of it and go for the preventive care also. Like every 3 to 6 months, they have to go for regular checkups and share their concerns. Like basically, it happens like most of the females don't like to share their concerns with other females or a healthcare provider. So whatever doubt you are having regarding your health condition and all that, ask a lot of questions to your dietitian or to your healthcare provider or to your doctor. That would be really helpful in the long run. And stay educated. Knowledge is power for me. Like, so stay educated regarding a particular health condition pertaining to your age, pertaining to your lifestyle. So proper nutrition goes a long way. So this should be started as early as puberty, and it goes a long way in delaying the onset of menopause. And lot of things happen post menopause also. So this can be delayed with proper nutrition. So utmost care has to be taken regarding this.
Thank you, Asfia. That was very comprehensive, and thanks a lot for your time and all the energy you have showed in explaining various details about personalized nutrition. Thank you. Happy Women's Day once again.
Thank you,
Looking
Doctor.
forward to contributions at Clear Cals and many more success to you and your clients in your journey. Thank you so much.
Thank
Thank you everyone for joining our Instagram live event today. Have a nice day.